As Jeremy mentioned, I'm located in northern Larimer County, so I'm in Fort Collins, which is along the northern Front Range of the Rocky Mountains in Colorado. And my organization, the Health District, conducts a triennial community health assessment every 3 years. And our last assessment round was last fall. Our main form of data collection, we actually do our own primary data collection for this assessment, and we conduct a survey using a random sample of households in our county, and then we weight this data to be generalizable to the adult population of our county. So last fall, we collected data from about 2,500 adults, and given really everything that our communities have experienced, we felt like it was very essential that we recontact each of those households for a follow-up this summer. So between August and September of this year, we followed up with every participating household, and were able to get responses from about 1,500 of those previously responding households. Of those, about 1,200 actually matched as being the same respondent who had previously completed our survey, which allows us to really make some good direct comparisons. So our follow-up survey itself included some repeated measures of indicators we felt were key to understanding the health of our adult population, as well as some questions specific to the COVID-19 pandemic. This is a lot of information, so I really am only going to be presenting top-line results of things that were significantly different or that we thought of were of interest. So generally, our adult population were pretty concerned about the pandemic, with 39% indicating that they were very or extremely worried about the COVID-19 pandemic. A greater proportion, 58%, said that their life had changed very much or extremely as a result of COVID-19. 1.25% were actually often or always concerned about getting sick from the illness or from the disease. And again, a greater proportion were actually concerned that someone close to them would get sick from COVID-19. So what we really wanted to understand was how this concern about the pandemic was influencing other health outcomes that we had previously measured. So one of those areas of interest was mental health, and we actually didn't see a change in the proportion who reported a current mental health issue. It actually remained stable from last fall, with 30% of all adults in our county indicating that they had a current mental health issue. We did ask separately whether people, or how often people were experiencing sort of anxiety, depression, or stress related to the pandemic, and about 36% of our adult population said that they were experiencing this type of stress at least half the time, but obviously not all of those also said that they were experiencing a current mental health issue. What we did see, however, was an increase in the severity of mental health issues experienced in the past month. So last fall, people reported on average about 3 days per month in which they had poor mental health, and this increased significantly to over 4 days per month this summer. We also asked people whether those poor mental health days limited their ability to sort of do their day-to-day functions. And people reported on average 1 day of mental health limitation per month last fall, and this increased to closer to 2 days this summer. We were interested in asking about alcohol use for some of the reasons that have already been outlined today. Our county tends to have higher levels of risky alcohol behaviors or high alcohol use compared to other counties and state and national averages. We did see that binge drinking decreased from 24% of all adults, drinkers and non-drinkers, who binge drank in the last month to 18% of all adults, which kind of makes sense with some of the restrictions around bars and restaurants. But on the whole, people were drinking about the same amount. We didn't really see a change in the number of drinks reported per week, and our proportion of heavy drinkers remained steady at 10% of all adults. However, we did have people sort of reflect whether they felt as though they were drinking the same, drinking more, or drinking less as compared to prior to the pandemic, and 27% said that they were drinking more. They tended to drink about one more drink, or reported drinking one more drink per week than they had previously. And it looked like these people were more likely to be ages 35 to 44. We know there have been hypotheses about parents drinking more, and we didn't really see any differences by gender or by whether there were children in the household. Unsurprisingly, but unfortunately, we have seen increases in unemployment. Last fall, when we did our survey, a very small percentage, 2% of adults, said that they were unemployed, and this did jump quite a bit to 9%. Of that, that breaks out to 4% being furloughed, 2.5% saying they were laid off, and about 3% saying they were unemployed. We also asked people to rate whether they had seen changes in their household income, and looking specifically at those who were not retired, about half had seen a decrease, a third of them had a similar household income, and 10% had seen an increase. And corresponding to this, we saw that health insurance through an employer declined from 71% of all adults to 68% of adults who receive their health insurance through an employer. Our other rates of health insurance and our unemployed rate, or sorry, our uninsured rate actually stayed the same. So we aren't quite sure where these folks ended up, but it does seem as though we're starting to see some changes in this indicator. We saw a pretty big jump in the proportion of adults who indicated that their household had needed financial assistance or welfare, going from 7% to 17%. I guess some slight, a good little bit of a silver lining is that a vast majority of those who needed financial assistance were able to access and use it. We saw a similar jump when it came to those who were worried about paying their rent or mortgage, tripling from 4% of adults to 12%. And we also wanted to ask about childcare and sort of the impact on work. About 30% of our population indicated that they had children under 17. Less than 10% of those said that they've actually had to significantly reduce their work due to childcare closures or school closures, but a much greater proportion were worried about what those closures would affect, how they would affect their work in the future. And I should note, we did this survey over the summer when there wasn't very much certainty at all about what schools would look like this fall. So you can see that our population was pretty compliant, or reported at least high levels of compliance with preventative behaviors. We also wanted to ask about access to healthcare, and you can see on the right there that a pretty low percent actually reported having to avoid going to a dentist or doctor as a result of COVID-19. Though this also includes people who probably had no need to see a doctor or dentist in that month. And finally, we asked about vaccine, our attitudes towards a vaccine if a safe and effective vaccine became available. 66% of our adult population said that they would take the vaccine, but a high proportion, almost a quarter, said that they were unsure. We also allowed people to sort of write in comments on this question, and we got some very rich responses that I won't be able to go into today. Last but not least, we had an open-ended question that was a repeat of a question that we had asked in our prior survey, asking about the greatest health concerns. People were actually quite nuanced and didn't just rate COVID-19 as we thought might happen. And it seemed like people were very concerned about a lack of compliance with regulations. Many of those comments were targeted towards young people and the return of college students to our community. Mental health concerns, school reopenings, the economy and job loss, and politics, partisanship, and societal division sort of rounded out our top 5 themes. So I'm very grateful that we were able to collect data at these 2 time points, and hope that we will be able to continue to do so as our communities face these great challenges. Thank you.